Great. So I feel like we've gone through so many different areas that overlap in many different ways. And we're now going to be heading into another area that does have crossover with other areas that we've seen. And I will be moderating this session. So I'm very excited to be part of this and helping to wrap up and close out the symposium with session 6. And just to give you a sense of what we will be covering, I'm going to read the description for you. So the global spread of COVID-19 was reported the daily news across different media, informing the public of how quickly the virus was spreading as case numbers surged and waned over time. Within the global view, visual journalism bridged science and storytelling to inform steps that an individual could take to protect from infection. This session emphasizes an understanding of individual risks, human behavior, air and fomite exposure, and viral tracking to inform steps that can be taken to help mitigate viral transmission. So lots of things we've been talking about now overlapping here, I feel like in a new context. So we have 2 speakers contributing to this session, Dr. Amanda Wilson, who's an assistant professor in environmental health sciences at the Mel and Enid Zuckerman College of Public Health at the University of Arizona, and Ms. Yulia Parshina-Kotas, graphics and multimedia editor from the New York Times. And presenting, welcome both of you. It's wonderful to see you here. And presenting first is Dr. Amanda Wilson. She studies microbial, I hope I am saying that right, exposure and risk assessment. You'll have to correct me if I'm not. Human behavior and exposure modeling. Recently, she has collaborated internationally to develop COVID-19 risk assessment models and co-developed a risk scoring algorithm for a COVID-19 contact tracing app, the COVID Watch. She was recently awarded a University of Arizona Health Sciences Career Development Award to expand her research training to address asthma and microbial risk trade-offs for healthcare workers conducting surface cleaning and disinfection. She received her postdoctoral training at the Rocky Mountain Center for Occupational and Environmental Health in the Department of Family and Preventative Medicine at the University of Utah, and received her PhD in environmental sciences at the University of Arizona. Dr. Wilson was featured in Hispanic Engineer and Information Technology magazine in 2018 and has been interviewed by Discover. Thank you for being here, and I will hand the screen over to you.
Thank you very much. Okay, let me make sure I can get my screen sharing going here. And is this the correct view?
We're seeing, I think, your notes view.
Okay, is that right?
That looks great. That looks perfect.
Okay. Problem with dual monitors. They're always getting me. All right. Thank you so much for having me. Today, I'll be talking about QMRA, which stands for Quantitative Microbial Risk Assessment, as a tool for informing risk-based design. I first want to disclose that I have worked on research that has been funded by a number of companies, including SC Johnson, Gojo Industries, and Ecolab Incorporated. And that's relevant to my talk today because I'll be talking about surfaces and surface hygiene, and these companies are players in that space. So I just wanted to disclose that from the beginning. I first want to address the hierarchy of controls, and this has probably come up related to questions about how do we limit exposures to hazards in the built environment. In occupational and environmental health, we're always asking ourselves, how do we control different hazards in different spaces, knowing that our approach is not going to be equal in effectiveness. So from top to bottom in this hierarchy, we have the most effective to the least effective controls, with the top 2 being elimination and substitution. So in a chemical plant, for example, if we're using a chemical to act in a certain process, if we can either eliminate that harmful chemical from the process or substitute it with a less harmful chemical, that's seen as more ideal than creating some type of engineering control to limit our exposure. In the world of microbial risk, though, it's really hard to eliminate or substitute. We can't just, unless our vaccination is really effective, we can't just eliminate a pathogen from the environment, right? There's going to be pathogens in our environment that we're always facing. And by pathogen, I mean an unfriendly microbe. For substitution, we can't just say, oh, let's replace this virus with a different one. And so because those top two hierarchies are difficult in a microbial context, it really leaves engineering as one of the most effective ways that we can address microbial risks. And so I really see, especially from some previous talks, that design interfaces directly with engineering controls and can have a really big impact on health in our built environments. Administrative controls and personal protective equipment, while very prevalent in our societies, they're seen as less effective because they depend on human behavior. And as we know, that can be very variable and unpredictable. And so not to say those aren't effective at all, but just that engineering controls can be a lot more effective because we're not relying on compliance or consistency. Today, I'll be talking a lot about risk on the individual basis and a framework that we use to quantify or estimate that risk. The framework I'll be talking about is quantitative microbial risk assessment, or also known as QMRA. QMRA has the same steps as a chemical risk assessment. Those steps include a hazard identification, an exposure assessment, and a dose response assessment, which are usually done at the same time. And these come together to inform a risk characterization, where at the end of the process, we have some type of quantitative probability of some health outcome. This process is very iterative, which I think is why it's so fun to be a researcher in this space. We're always learning new things about the microbes in our environment. So we may get done with a QMRA, we have this idea of what we think a certain risk is, and then we learn more about the pathogen, or we learn more about human behavior and how people are truly exposed. And that comes back and informs our hazard identification. So this process is always improving on itself. We're always learning more. We're always improving our estimates of what we think specific risks are. And if you're interested in sort of learning about QMRA from the ground up, I really recommend the book highlighted on the right. That's sort of a really nice overview of what QMRA is, by Chuck Haas, Joan Rose, and Chuck Gerba. So I'll now go into a little bit of detail to give you a better sense of what each of these components in a QMRA looks like. During hazard identification, we're asking questions like, what is the microbial agent that we are concerned about or interested in? What is the health endpoint? In a lot of situations for the health endpoint, we're interested in infection, but the health endpoint could also be illness. So as many of you probably experienced during COVID-19 or heard about, just because you're infected doesn't mean you're necessarily symptomatic and ill, right? So those are distinctions we make in QMRA. Maybe we're interested in a mortality endpoint, or there's certain pathogens that pose very specific endpoints. So I recently was pregnant. I just gave birth to my son in July. And for anyone on the call who's been pregnant, you probably know, to avoid lunch meat and cheese and, these things that are known risks when it comes to Listeria monocytogenes, and a really common health endpoint for that microbe is stillbirth. So there are, specific endpoints we may be interested in depending upon the pathogen. We're also interested in how is the disease caused? How are people exposed? Which leads me into the next component of QMRA, which is exposure assessment. In this part of the QMRA, we're asking ourselves, how is this pathogen present in the environment? And at what concentration? That's a really key part. So not just, is it there or isn't it there, but if it is there, what's the magnitude of its presence? What's the concentration? We're also concerned about how it's transported. So are we worried about air? Are we worried about the air surface interface? So looking at, deposition and resuspension, some things that I'm sure have come up in previous talks. Are we worried about water? How persistent is it in different environmental media? So by that, I mean water, soil, organic matter, air. How do we remove it? From an exposure assessment, we estimate a dose. So we look at what we know about its presence in the environment. We look at what we know about human behavior. And we say, okay, if I have ingested this much virus, or if I have inhaled this much virus, what is the probability of my health endpoint, which is usually infection? So we're looking at a probability, a number between 0 and 1. And the takeaway from this figure from a paper by Van Abel et al., where they were looking at dose response data for norovirus is that it can be really complicated to try to mathematically relate a dose and a probability of infection. So this is one component where we're always trying to improve. We're trying to gather new data, whether it's from animal studies or human studies or epidemiology, to look at, do we really understand how dose and probability of infection or some other health endpoint are mathematically related? Because again, remember, this is quantitative microbial risk assessment. We want a quantitative output at the end. All of these pieces then come together to inform risk characterization, where we have some type of probability of a health endpoint. The next logical question is often, okay, is this acceptable? Reaching a risk of 0 is not an achievable goal. So how much risk are we comfortable with? And that's a very complicated question. But once we're able to get a sense for whether that risk is acceptable or not, we then ask the question, okay, if it's not acceptable, what controls are needed to get us below that level that we deem acceptable? So much of my work is looking at, are we reaching an achievable risk? And if not, how much reduction in that magnitude of a pathogen's presence in the environment do we have to achieve in order to meet our risk targets or risk goals? So this was a study in which we used exposure models, some type of mathematical representation of what people are exposed to and their potential risks, to rotavirus, rhinovirus, and influenza A virus on contaminated surfaces. Rotavirus is really infectious. It causes really nasty gastrointestinal illness. It's something that you're definitely concerned about in a daycare kind of setting, although there's a vaccine for it. Rhinovirus is like the common cold. And then I'm sure we're familiar with influenza A virus. So what we did in this study is we looked at ways of estimating what the concentrations of these different pathogens would be on surfaces and in indoor environments, and looked at what reduction in those concentrations would we need to achieve a 1 out of 1,000 risk target, or 1 out of 10,000, 1 out of 100,000, 1 out of 1,000,000. So in other words, if there were 1,000 people, one of them would be getting sick, or 10,000, 100,000, 1,000,000. And we looked at what reductions would be needed. So these might seem like really silly numbers, like 99.89, or you maybe have seen those labels on, clean your disinfection products, kills 99.99% of microbes. And people are always really confused by that. Like, how can they measure that? What we're really talking about here is log reductions. So the concentrations of pathogens in the environment tend to be log distributed, which means we can have really, really, really high concentrations. We can have really small concentrations. So we're often talking about changes in their concentration on actually orders of magnitude, like power of 10. What we see here is that we see needed reductions for rotavirus and rhinovirus, but interestingly, we didn't see any needed reductions for influenza A virus. The reason for that is, in the case of our study, the dose response for influenza A virus is very different for rotavirus and rhinovirus. It actually takes a little bit more influenza A virus to cause the same level of a probability of infection than rotavirus and rhinovirus. So the take-home message here is that QMRA can allow us to look at what are the needed reductions, not just for pathogens in general, but very specific pathogens that we might be concerned about during specific times of the year or in specific spaces. So what individual risks are acceptable? Well, you can imagine this depends on a myriad of factors. So just to name a few, how frequently are we exposed? What's the magnitude of the health outcome? I'm going to have a much different acceptable risk if the outcome is death versus infection. What are perceptions in the community? What do they know about this pathogen? And what is our ability to control a potential exposure? In the world of drinking water, which is where QMRA originates, we have a risk threshold of 1 out of 10,000 risk of infection per person per year. And this is a goal that the World Health Organization and the U.S. Environmental Protection Agency use to guide water quality advice. So that means out of 10,000 people drinking their drinking water, we're accepting 1 out of 10,000 of those people getting infected from their drinking water. We then can work backwards and say, okay, let's look at the water sources that we have at our disposal. how many powers of 10 would we have to reduce concentrations of pathogens in those bodies of water in order to meet this risk target? And those reductions are called log reduction values, or LRVs. And we're often looking at a number of different treatment options and combining their log reduction values, deemed log credits, and looking at a combined approach. So going back to that layered cheese model, we're thinking about bundles of interventions that get us enough reduction in the magnitude of these pathogens to achieve a risk target. This type of risk approach is gaining more traction in the built environment. So how can we compare different interventions at our disposal? How can we compare different quote log credits that could be combined to reduce risk? And so, for example, implementing something like a copper surface that has a biocidal effect versus another type of surface could be something where we're looking at what's the log credit of using a copper handle instead of stainless steel, for example. QMRA is also really good at exploring unknowns when we are in a place where we don't have a lot of data. So during the pandemic, in the beginning of the pandemic, there was a lot of emphasis on surfaces, right? Make sure you're cleaning, disinfecting. But engineers and aerosol scientists were shouting for a long time, desperate to be heard, that airborne transmission deserved a lot more attention than fomite transmission. And so we set out to do a risk assessment. We were like, hey, we know how to do fomite risks. Let's do a risk assessment and look at what the risks are from surfaces. And maybe we can help, put the attention back on airborne risks. So what we did is we developed a model where we were assuming a single touch with a contaminated surface, followed by a single touch with your face. And we looked at, okay, what if the viruses on the surface what if the concentration was really high? So that's represented by the darker shaded box plots. What if it was relatively low, represented with the lighter gray? But this is a measure of genome copies per square centimeter. So genome copy just means we're detecting genetic material from the virus, but we really don't know, is that virus capable of infecting somebody or not? So we said, what if only 1% of the genome copy material reflected an infectious virus? What if 10% did? Then we said, what if we didn't change cleaning protocols in healthcare at all? What if we added a 1 to 2 log reduction, 2 to 3, 3 to 4, 4 to 5? And then how do we stack up against these commonly used risk targets, like 1 out of 10,000 in the red line, or 1 out of a million in the orange line? And what we see here is that regardless of uncertainty about how much of the genome copies we're detecting reflect infectious virus, regardless of uncertainties about the viral bioburden on surfaces, that we actually are sitting at a pretty good place risk-wise without adding any additional cleaning and disinfection. If we want to be really conservative and aim for that 1 out of a million risk target, maybe we need like 1 to 2 logs to achieve that. But guess what? A lot of products have that type of effectiveness. So again, this helped inform the fact that fomites really aren't a big concern. And we were really excited that this was cited by the Centers for Disease Control and Prevention in a scientific brief, basically saying, hey, this is what we know about fomites, and we really need to turn our attention elsewhere when it comes to COVID-19 transmission. That said, it's not to say that fomites aren't important for every pathogen. For some, it is really important, especially healthcare-associated infections. Some other work that we do with collaborators is viral tracer studies. And this is, I think, super cool. There are viruses that only infect bacteria. We call those bacteriophage, which means that they're safe to put in the environment. So our institutional review board is okay with us seeding surfaces and environments with really high levels of these bacteriophage, and then looking at how far they spread in an indoor environment. This was a study in a healthcare facility where they had healthcare skilled nurse living quarters adjoined to an independent assisted living quarters area. A surface in the team room and nurses station were seeded, and within 4 hours, levels of detectable virus spread to all of these different areas, including in an independent assisted living quarters wing where there are, many immunocompromised people. So this is to show that if this were a pathogen, it could be spreading very quickly in this type of environment just through hand to surface contacts. I'm sure Professor Sally Bloomfield mentioned this. Targeted hygiene, or this idea of optimizing our cleaning protocols, is really on the rise. I think during the pandemic, people started cleaning a lot more often, with a lot more intensity, and that can be a problem. And I don't feature it here, but some of my other research is on the risk-risk trade-offs related to that. There's about 30 years of research showing increased asthma risks for healthcare workers engaged in increased cleaning and disinfection. There's research on cancer risks from cleaning products among cleaning product exposures among maids. There's animal study research that some disinfectants actually pose reproductive health effects. So we want to be really careful and targeted about how we use these types of interventions. We may be focused on specific surfaces or specific moments, like after cooking with chicken, something that we would think would contaminate our kitchen. Or we may be focused on surfaces that are commonly touched, like a doorknob or elevator button. But this, I think, brings up an important question, and I don't necessarily have the answer, but I just want to pose it, that if this targeted hygiene protocol is on the rise and we're focused on some high-touch surfaces, are the materials on these high-touch surfaces designed for frequent cleaning and disinfection, or are we going to be damaging these surfaces over time and creating new places for microbes to hide in little microscopic nooks and crannies? A concept related to fomite transmission is this idea of transfer efficiency, or if I touch a surface, how readily do viruses transfer from my hand to the surface and from my surface to the hand? There was a study done looking at how transfer efficiency differs by material type and also directionality. And so these researchers found that surface type was a significant factor that affected the transfer rate of Phi6, which is another phage. It was more easily transferred to and from stainless steel and plastic than to or from painted wood. So this just goes to show that even choosing different types of materials could mean different things for how quickly viruses or other pathogens may be spreading around in our indoor environments. And in our models, we can account for this, which I think is really fun. Another thing that we often account for in our research is how much of your hand are you using for different contacts. So you can imagine if I'm opening a door handle versus using a pen, I'm using a much different fraction of my hand and different areas of my hand for those contacts. So this is a paper that we often turn to look at actual measured fractions of the hand used for different types of contacts among children and adults. A surface type that's been gaining a lot of attention and there's a lot of research on is copper. And in 2021, the US Environmental Protection Agency was announcing that certain copper alloys provide this long-term effectiveness against viruses, in this case for SARS-CoV-2. So I won't go into detail here, but I just wanted to raise the point that there are a lot of materials that are gaining more attention in their ability to serve a purpose in terms of infection control. I briefly wanted to touch on water as well. There's been a lot of growing research about Legionella pneumophila and risks in the built environment. So I'm going to come back to this study. I first want to give a little bit of background on Legionella. Legionella causes two patterns of disease in humans. It causes Pontiac fever, which is a mild flu-like illness, but then it also causes a really serious disease, Legionnaire's disease, which can be fatal, especially for the elderly and for male elderly. It enters into the body when aerosols of contaminated water are inhaled, and Legionella is just widespread in natural fresh water. It's just there. So we have to face the reality that it can be in our water systems. This is just one example I found in the literature of an outbreak associated with a decorative water wall fountain in a hospital. There are others. And this was an interesting case where the fountain was actually cleaned and maintained really well, but Legionella pneumophila, serogroup 1, was isolated from a foam material found above the fountain trough. So this goes back to, I think, what was discussed in the previous session is some of these interventions meant to have psychological health benefits, may introduce some type of environmental health trade-offs, and we have to sort of face that and decide, okay, if we do implement something like this, what are the controls that are in place to ensure that we're not introducing a place for Legionella to grow? In that paper I showed earlier by Hamilton et al., a really interesting aspect of their risk assessment is they were able to compare risks associated with conventional faucets, conventional toilets, conventional showers versus water efficient toilets, showers, and look at how, what do we know about the aerosols that are produced by those different water fixtures, and how does that influence risk? In this case, the water efficient fixtures resulted in slightly lower risks than the conventional, but I think their main takeaway here was just demonstrating that QMRA is a powerful tool for furthering our knowledge about what types of different water fixtures may pose risk benefits or risk reduction benefits. Another study I was involved in related to design had to do with the placement of furniture. So even the placement of furniture can have an influence on exposure in two different ways. The arrangement of furniture can affect the order in which we touch different surfaces, which affects how frequently we touch one surface versus another. And it also can affect where the air goes. So in this case, we have air coming in through some windows. There's a patient that's sitting on one side of the room. We then looked at what if the patient was sitting on the other side of the room, and we're looking at where the particles emitted in the breath of the patient go. On the left, when the patient is seated near some windows, the air from the windows is pushing all those particles out the room for the most part. But on the right, we see the particles floating around, going everywhere, providing more opportunities for them to land on surfaces. We then wanted to know, how could this translate to exposure for healthcare workers who are touching surfaces and interfacing with the patient? We also collected human behavior data, and we anticipated some differences because this was done with some collaborators in the UK. And in the UK, doctors are trained to approach the patient from the right side of the bed. So we actually did see some differences in their sequences of what they touched and when they touched it. But when we looked at how that influenced the building up of virus on the hand over time, so you're looking at concentration of virus on the hand over time estimated by our model. If we just look at the behavioral differences for these two different room layouts with the patient either facing the left side or the right side, we really don't see a big difference in accruement, even across different care types being done. However, when we account for both the behavioral changes introduced by this different room layout and the airflow changes and the effect of that airflow change on how things interface with surfaces, we did see some interesting differences in how things built up on the hands over time. Another area of my research is this human behavior component. So one of the big questions that came up during the pandemic was, how often do we touch our face? And what we found is, well, it depends. It depends on where we are. So we looked at data from airports, bars, churches, classrooms, food courts, museums, public libraries, and more, and looked at how often do people touch their face, their mouth, their nose, their eyes per hour. And so something that is related to this topic is, if we are in a public location where people can see us, we might be less likely to touch our face, especially our nose, than if we're in private, right? So understanding how does visibility affect these behaviors is a growing area of research. We also looked about what if we are eating versus what if we're not eating? How does that affect how often we touch our face? So this is my daughter Aria after having dinner, and there's visible evidence of her making a lot of hand-to-face contacts while enjoying some Greek yogurt. And our research show a similar pattern here, where we saw that when people are eating, they tend to touch their face a lot more than when they're not eating. And someone's reaction to that might be, okay, who cares? That seems obvious. But during the pandemic, there was some concern about nurses being exposed in break rooms or actually walking in between patient rooms. So it was such a busy time that some healthcare workers didn't even have time to take their lunch break. They were literally like eating a sandwich between patients. And so we were concerned about the potential for increased hand-to-mouth contacts during those behaviors. For those of you on the call who are parents or guardians of small children, you probably already know this, but our data support this as well, that children tend to touch their face a lot more than adults, both their mouth and their eyes and their nose. But interestingly, when it comes to other parts of the face, adults tend to touch their face a lot more frequently. So I'll wrap up with some key points here. QMRA is a powerful tool for estimating individual exposure. comparing different interventions or bundled interventions, evaluating the influence of design on individual risk, and defining goals of performance for design interventions. Some of the examples I gave today in terms of how design choices can impact infection risks on the individual level include the placement of furniture, water fixture choices, whether someone is going to be eating or not eating in this space and how this influences their hand-to-face contacts, and the type of surfaces we're using and potential differences in transfer efficiency. And here are some references. I'm not sure if the slides will be shared, but I've provided them here, and also some contact information if you'd like to reach out with any questions or to discuss further. Thank you.
Thank you, Dr. Wilson. That was incredible to hear, especially being able to summarize and pulling in, what designers can do and taking all of that information and trying to think about it in our built context, which is really helpful. So thank you so much for that. So now I would like to invite Ms. Yulia Parshina-Kotes up to the screen. Wonderful. She is a reporter and graphics editor for the New York Times. She uses her background in 3D visualization, motion graphics, and traditional animation and illustration to cover a variety of breaking news and investigative stories. Before joining the Times in 2014, Yulia worked as a motion graphics designer and 3D artist, creating interactive experiences, spatial installations, and linear animations for cultural institutions, advertising campaigns, and children's television. Yulia teaches visual journalism in the Interactive Telecommunications program at NYU Tisch, and has previously taught motion graphics, design, and immersive storytelling classes and workshops in Pratt Institute, CUNY, which is the City University of New York, and Columbia University. Thank you for joining today, Yulia, and I will hand the screen over to you.
Thank you so much for having me, Lois. Can you hear me well?
Yes, perfect.
Okay, perfect. Let's see. And are you able to see my screen okay?
Yes, everything looks great.
Okay, excellent. Thank you again so much for having me here. And wow, I am humbled to follow Amanda and pretty much any session that involves real scientists. That is something I am deeply interested in, but could only enjoy peripherally in my career. But as Lois mentioned, I am a visual journalist at the New York Times. I've been there for about 9 years, and I cover such a different array of topics. But my main entry point into these topics is by using motion and 3D, immersive storytelling like virtual and augmented reality, and even traditional animation illustration. Things that move, basically, is a way to summarize it. Lois mentioned it, but I wanted to reiterate that before I came to the Times, one of my favorite things or parts of my career was working with physical spaces on museum exhibits, creating media that was truly immersive in a physical and embodied sense. And I think that time and thinking of visuals in such a way, things that surround you that are spatially placed has influenced the way I think about the kind of work I do and being able to visualize information. And so I wanted to, take you kind of behind the scenes of this one story that I worked on in 2020 about how masks work. At the time, information was coming out about COVID. We were linking it to aerosols and, air of it being spread through air. But masks were clearly a way to protect ourselves. But there was such a debate about masking that we really wanted to dive into the science behind how they work and just, show and share it with the public in hopes that it could, instill some sense of, safety and give people a tool and an understanding of how this tool works. So I will briefly take you through the actual story itself. Just to give you a sense of what it looks like before I give you a behind the scenes of how it came together. This is a story that dives into a mask, like deep on a microscopic level. You dive into the fibers, and you look at particles, which we, for the layman broke up into these 3 different sizes to explain filtration mechanisms and how, the actual, invisible science of how masks, capture these different particles of different sizes, and why some particles are easier to capture than others. We also discussed, the role of a shape of a mask on how well it can protect, and the thinking a little bit about what risk means, and if more people mask, how the risk can be reduced, and then talking about individual responsibility and a person's actions within in space and how they can further help reduce the risk. So that was a story. The science has come a long way since then. I hope and believe that the basic mechanisms that we covered in the story still stand true and are also relevant to filters inside rooms and other filtration tools that we have to help protect us against COVID. So, when we started thinking about masks, and we wanted to, better understand what these mechanisms are that help masks work, myself and my reporting partner, Badel Sajay, we each read over a dozen research papers. And, as I mentioned, I do not come from a background of science. I have an infatuation with science, but, especially when it comes to filtration, that is not, an area that I'm familiar with. And so, like with many other projects I work on, I become a temporary expert, and I have to dive in real quick and become really familiar with the subject. And beyond reading as much material as is out there that we can get our hands on, the most important thing is talking to scientists. But while even before we even got into conversations, the way that we've seen the idea of filtration presented was this top-down, very clear, very clear diagrammatical view, but very top-down and flat view of viewing what filtration is. You usually look down at a fiber, and the particles, these droplets that are floating around a fiber, and you see these like microscopic, physics happening, on this like very flat diagram. But when we started looking at, mask at that microscopic level, it is this spatial phenomenon. It's this, deep entity that you enter. It has thickness. There's such a distance that such a tiny particle would have to traverse to come through it. And so just even beginning to look at the visuals, in this case, these are images from electron microscopes from a variety of research papers. Just even starting to look at the mask from this perspective, really like changed the way that we were thinking about it. And of course, talking to scientists is probably was key to really getting a better understanding of what this space even means. One of my favorite conversations was with Dr. Zangmeister, who was part of a chemical process and nuclear measurements group, and he was studying at the time the properties of fibers of different kinds of materials that people might use for masks, just to share back with the public in terms of the safety that different materials can provide. And I think one of my favorite, he gave 2 different kinds of examples of for like a layperson like myself to understand what happens to a particle as it enters a mask. And he first described it in terms of Star Wars and that scene when you're going through the asteroid belt, and that was such an imaginative way to describe it. And then he kept referring to it over and over as this like swath of spaghetti, or he even used the word like spaghetti forest. And so this idea of a spaghetti forest really stuck and really made us appreciate, the spatial nature of this phenomena. And so, the first thing we did, and this is work by my very talented colleague Ur Fleischer. He started to try to generate or copy this naturally occurring fibers, as a 3D model. And so he was trying to generate something procedurally that would have the same density, the same variability of, thickness of the fibers. And, he was trying to build something that was, existed in space that we could start, visualizing over. And so, we had these two very different approaches. We had this kind of a flat explainer that we wanted to live inside of this, within the space. But that's, when you're telling a story, once you got there, like we knew we were going to go and take this into a 3D realm, then we had to figure out like what is the way that we will tell the story? Will we be looking at it statically? What will the camera be doing? It's really, this is where, you take all this research, all these papers, all these interviews, and you try to find the thread of a narrative within it and try to build that narrative visually so that it makes sense. And it's really like thinking as a cinematographer, thinking as a filmmaker. And so this was, we looked at a lot of references, a lot of research, and at some point, as always, 3 a.m. in the morning, I couldn't sleep, and I'm like browsing very random references. And I came across this, I don't know what this is. It was some experimental GIF, that just, a tunnel that keeps looping. But seeing it, and I don't know why I didn't click earlier, it was so obvious. Seeing this made us go, oh, we should tell the story from the perspective of the, potentially infectious particle that is traveling through this mask. It should be the journey of the particle that traverses the spaghetti forest, of obstacles and maybe doesn't make it till the end. And so we began storyboarding. I started drawing, all the like mechanisms of filtration, but laid over this messy 3D space. But like any good story, it's not enough to get into the heart of it, the meat of it, which is that explainer. You really have to again, this is where the cinematography of it comes in. You really have to think about how you enter the space and how you exit it. And it always has to come back to the human element. And this is where I think, the work that someone like Amanda does is so important, because you're always thinking of the humans within this realm, the humans who are going to be reading the story, the humans who are going to be thinking about masking. And so you're always with a story that tries to explore the invisible, like many science stories are. You always want to think about and bring it back to the human scale, to the level of the person. And so we chose to enter the story, as you've seen when I was scrolling through it, at the level of the people, where you can relate to somebody standing in a space, being in a space with somebody else. And then you dive in and you exit in the same way, and you end with a group of people, so that it brings the point back to something that is personal, to something that is at a human scale. And I started building it out in 3D. So we've had the research, we understood how these, the mechanisms work. We had these fibers that my colleague Orr was building, spatially. But we now had to take a camera and have that camera guide our readers through this, forest of fibers where the particles are getting captured. And there was so much happening. There was such a choreography involved that I actually had to take the procedurally generated fibers and rebuild them completely, and basically build a theater stage within which the drama of the infectious droplets could unfold. Because every fiber had to be placed just so, tilted just so that we could, recreate this idea of these particles being captured. This story is a little different than some other stories I've worked on that we represent spatially, in that this was a recreation based on the interviews with scientists, so that this animation that is happening is an interpretation. And of course, we have gone back to every person we've interviewed just to make sure that we're capturing what they were describing. But unlike other works where we have used simulations that exist. This one was, a recreation of the process as we understood it from our interviews. And then, of course, the question of design comes in. We have the animation, we have the timing and like the storyboards of what we want to say and what we want to explain. We're writing the text based on our interviews with the scientists. And now we have to design this physical space in a way that is going to be appealing to our readers, in a way that is going to be impactful, and in the way that is going to be clear. And often, once I understand like the physicality of the world that I'm trying to represent, I'm going to go out and look for references in the most unlikely places. So, I have looked at images of masks under, an electron microscope, but I will then go into a completely random visual pieces to try to draw inspiration for color, for giving a sense of depth, for movement, because again, this is an abstract concept, invisible concept that we're representing, and it has to be clear. And there's such a hierarchy of information, a visual like hierarchy of information, that is always important to remember in terms of clarity and what you're choosing to highlight and expose. We looked at how we should represent particles. We, then we started thinking about, okay, so what will the space be? Will it be light or will it be dark? We started out playing with this kind of very ethereal white world and realized that it just wasn't giving fibers, which were a key player in this, particle mask drama. We weren't giving fibers the place they deserved. So we switched to a darker background. We chose, we played around with different symbology to represent airflow and ended up representing it by, giving little tails, motion tails to the particles rather than arrows, because we didn't want any distraction in this already busy space. But there was a lot of these considerations that built up into this world where the fibers stand out, but just enough where there's depth, where there's, these kind of comet-like tails that help guide your eye to the particles that we're trying to highlight. And then the people, we represent people in very different ways depending on the subject. And in this subject, we really decided to flatten the people. So even though we're bringing you in through the lens of this, human experience, we also didn't want to over-represent the human and get into this uncanny valley of 3D. And this is something that we're always trying to improve, but representing the human form respectfully and artistically, that in a way that will not distract from the more complex subject that we're trying to tell. And of course, for us, it doesn't end there. There's always the struggle of understanding the way that people enter this experience or the virtual space that we've created. People enter it through a desktop, which is really wide, and people enter it through a mobile device, probably more frequently than a desktop, which is very narrow. And so designing something that has to be clear and legible, with labels that are very important, with highlights that are very important, at these very different kinds of, forms, these entry points from desktop to mobile, different scale, different cut. The way that we animate, the way that we place information in this space is so important because it has to work at every scale. And so we actually end up often making several versions so that they can work on a variety of platforms. And of course, New York Times is still, has a print aspect that is so important, and that is such a different medium, and it works completely differently. So for print, we have completely reimagined what the color scheme and what the sequence of events will be. It's a static medium, so translating what you were able to show spatially in a virtual world is such an art, to be able to then have it make the same points and have them feel sequential but over a flat page. So that is a little bit of a behind the scenes of masks. But Lois, could you correct me if I'm wrong, but I have about 10 minutes. Is that right?
You do, yes.
So I sneakily wanted to go beyond the masking story that talks about taking something that has been flat and represented space, reimagine it in a spatial way. I wanted to sneak in another story that is COVID related, where we took something that could have been spatial and chose to do it in a flat way. So there was a story that we worked on in a little bit earlier before the masking piece that took a look at how COVID-19 was affecting meatpacking plants. Because at the time, if you remember, meat was disappearing off the shelves, prices were skyrocketing. And that was because the workers in the meatpacking plants were falling ill. And so we wanted to investigate and try to understand it like on a systematic level to see what is causing workers to fall ill and try to examine the space and understand the space itself. And so we worked on the story that in a linear way took you through what goes on behind the scenes of a meatpacking plant and how the placement of workers within that space is ultimately resulting in them falling ill and not being protected. And so this is kind of a very different way of telling a spatial story or visualizing a spatial story, because it was a story of space. And a lot of times the way that it was appearing in the way it was playing out in the media is through these very dramatic photographs. Now, these photographs were important to give people a sense of what working conditions were like for workers in a meatpacking plant. But it's also very distracting when you're looking at images of meat, especially images of meat. It's very hard to make sense of the space and what is happening. There's such chaos. So we wanted to tell a different kind of story and to really analyze of what the space is like. And we've seen some stories come out. I believe I'm trying to remember where this image came from. I believe it was from, might have been USA Today. They did like this little graphic, 3D graphic of where, what it is like to be inside a meatpacking plant. But very soon after starting to investigate, like starting to just look at videos and starting to read about what the different steps are within a meatpacking plant, we began to realize like this graphic is not representative of a meatpacking plant spatial layout and processes like in the large ones, in the large plants that are responsible for majority of the meat production, treatment, and where the workers were mostly getting sick. And also like looking at a 3D graphic, it was very like, there's so much to look at. You're looking at the workers, but you're also looking at the equipment. And it felt like it was distracting from a very important point that we found actually on the CDC website. And it was a linear issue. It was the issue of the distance between workers. And so we wanted to understand why there was no space between workers and why workers could not actually step 6 feet apart. It was a very, very deep dive. I must have looked at like 100 videos of meat being prepared and some layouts of like industrial, like prefabricated, like or pre-designed layouts of meatpacking plants that were being available online. Spoke to experts. It was very hard to interview people in the meatpacking industry. They were understandably very weary of journalists. But over time, we came up with this map. And I think this was probably the greatest accomplishment of this story, was just being able to understand how the flow works and understanding what the distances are between people in each part of this flow. And again, this is like, yes, you could visualize this in 3D, but in terms of conveying information, in terms of giving the relevant information to our readers and to even to ourselves as we're reporting this was the view that we wanted to have into it. First, top down, because we wanted to understand what the process is of like a generic but large scale plant. And you can see that the people were getting closer. And so then we get closer and closer as we got towards the end process. And so then we were able to have these more, kind of neutral illustrations where meat was an object, but not, it didn't give that visceral reaction of like red meat in your face, so that you could really think more analytically about the space and about what is happening. And, again, represent the human form with elegance, with respect to the workers and with dignity. And, just show incrementally over time in this very linear process, because a production line is inherently linear, show how as the space continues, people get closer and closer and closer, and just how much humanity is needed to treat meat. Because this is one of the thing we walked away with, was how absolutely not how absolutely not automated this process is. And it was just a very interesting thing where we went into it thinking, oh, we will create a 3D graphic of the way that these meatpacking plants work. And we pulled back and did kind of the opposite take of the masking story and chose to represent this in 2 dimensions as a flow. So thank you very much. I hope this is helpful. It's a very different way of looking at safety and information. I mean, I do not come from a scientific background, so everything I learn from the people who are willing to speak with me and fact check everything that I was doing along the way. But thank you, and here is my contact information if you have any questions or want to stay in touch.
Wonderful. Thank you so much, Yulia. And I'm so glad that you did include that other part, because I really think it goes back to this idea of, visual journalism also being investigative and revealing information that visually you were able to extract by looking at these images. So that was really wonderful to see. So I would now like to invite back Dr. Wilson, and that way we can begin our question and answer session. And for the audience, please share any questions that you have, and they will reach me so I can share them with our speakers today. And I do have a few questions, some that I prepared knowing about your work. And I think, both of you are coming from very different areas, but it's so interesting to see how there can be overlap between the two. And when I think about the work that I'm seeing, that overlap comes in at certain points, such as where it's trying to see something that's invisible, or an invisible concept that somehow has to become clear or come to the foreground. And Yulia, that was one of the pieces that you said that jumped out at me. But I was also thinking about, Amanda's, your work too, where suddenly when things are invisible, how are you trying to find them during these risk assessments? And so there's a few questions building upon that. And let's see, I'm just going to my questions. And I'm just going to jump into one of the questions I had, which was, a lot of what we've been looking at today, and in I think in both of your research, especially related to COVID, what's come across is what is not visible to the eye. And this is kind of moving a bit into the realm of interior design, where we're so used to working at the scale of, an architectural scale at 1/16 of an inch or metric at 1 millimeter. And suddenly we're looking at things that are either patterns that are not visible, or microns, or things that we just don't see at the scale of the eye. And was just wondering if you can offer any guidance for interior designers. And it's, we know you're not interior designers, but just at the scales that you're working with, if you can just elaborate a little bit more on what they mean spatially, so that way we can begin to start understanding them at the scale of the interior and the things that we're looking at. And the past 2 days has really been about looking more inward and closer to try and understand, fomites, the materials that they land on, or looking at being the particles moving through a mask. So I hope this is a question that both of you can elaborate on however best fits. And maybe Amanda, I'll come back to you to see if you want to start.
Okay, sure. I just want to say, Yulia, that was incredible. I was blown away. I was like, but I think something that you said makes me think about an answer to this question, which is something that was impactful that you said to me was we realized we had to tell the story from the perspective of the particle. And I think that if I'm putting myself in the shoes of an interior designer, I think like putting yourself in the place of a pathogen. Like if I were a harmful microbe, where would I be? And I ask myself this question a lot when I'm walking my dogs in Tucson, Arizona. Like if I were a rattlesnake, I'd definitely be in those rocks, you know? So like I'm not gonna walk over there. But just sort of thinking, I think, you know, attending these types of sessions, like, okay, if I were a pathogen, I could be in the air, I could be on a surface, and I'm going to leave a surface in a different way if it's smoother versus if it's rougher, and there's places for me to hide, you know, so sort of like anthropomorphizing, you know, the thing that you're thinking about, this invisible quote enemy, you know, not that, I mean, I'm focused on pathogens, so harmful microbes, but yeah, I think that can like give context into thinking about where microbes might be, how they might transfer between different spaces when you can't see them.
I think from my perspective, it would be, and by the way, Matt, I'm equally blown away. It was a humbling experience to follow your presentation. But from my perspective, it's always, you know, trying to bring it back to the human scale and what it means in the context of a human scale. So, you know, for anything we're visualizing, whether it's like invisible because it's microscopic, or it's invisible because it's such a big system like a meatpacking plant that you can't, you know, grasp it without trying to dilute it into something, you know, clear and simple. It's always bringing it back to what it means to a human, and always, you know, what does it mean to be human in this environment if there is this invisible, you know, 1/16 of an inch element that may or may not pose danger, that may or may not impact them in some way? What does it mean for their body? Which part of their body, like, you know, always relating it back to what does it mean to exist in your body in that space, and trying to like, what will ignite your imagination to be able to relate it back to yourself? Like what aspect of which will make you have that empathy, have that like imagination, like click.
That's great. Thank you. And so we do have one question that came in that goes back to masks, but also behavior. So this might also span both of your research and work, which is, can you suggest how people can be supported to overcome social conformity and masking behavior? For example, when individuals want to mask but don't want to stand out when few others are masking. And I think that's a huge part of what has been following throughout COVID. So it'd be great to hear any thoughts on that.
And it's so complicated because my thoughts on it are not as a researcher, but you know, as an individual as well. When COVID began, you know, I working in a newsroom, I did not know anything about pathogens and how what it means for a disease to be airborne. But I quickly learned, and I guess not being a scientist and not coming from that background and learning so much in such a short amount of time, I've personally developed such a fear, I was such a devoted masker. You know, I've worked on a masking story. I had a concept of how it works in my head from what I've heard from very, very smart people, much smarter than I am. I mask diligently. But I also have young children who were going back to school, and it was such a, I guess I don't have an answer, but I think I can say that I very intimately felt the tension between having my imagination very ignited, trying to imagine the invisible all the time, maybe to a way that was not helpful, and then having to deal with realities where, you know, my 2-year-old was masking, you know, doing the mask and like wiping her nose, pulling her mask down, rubbing her boogers, and, you know, being like someone who in theory has visualized it, but in practice is dealing with the very deep humanity of it and what it actually means in real life, and feeling the stigma, and feeling that disconnect of going from place to place that had very different philosophies about it.
Yeah, and I can also only imagine after working on a story about masks where it seems like you've taken the deep dive into it, that you probably do have a very different perspective on it. So that's really great to hear. Yeah, and Amanda, I'm not sure if there's anything you want to add.
I just wanted to add that I think it's complicated because wearing a mask, I think, can be symbolic of different things, both outwardly and inwardly. And that's an interesting place where the sort of like social sciences interfaces with engineering and physics, where like we know masks have these physical mechanisms by which they work, but what exactly does it mean when I put one on at Thanksgiving and no one else is wearing one, or, and I don't have anything eloquent to say other than there's some really interesting research on how to play with people's like perception of responsibility. So I think personal protective equipment and certain hygiene behaviors can elicit that feeling. And I remember reading some really interesting papers in infection control journals around hand hygiene, where they were trying to get healthcare workers to be more compliant, whether that's like actively deciding to wash or sanitize their hands, or just mindful, like, oh, I need to remember to do this. And they found that there was increased compliance when they actually put an image of eyes above hand sanitizer dispensers. And just this feeling of being watched, a reminder of personal responsibility. So I don't know how that relates to masks, but I feel like it's it's a complicated issue.
I'll also say that for someone who's not a scientist and who has learned about it, it was such a difficult thing to navigate, even with people who genuinely agreed with one another in theory, but in practice, some were advising that only N95s work and everything else doesn't matter. And some are saying, well, yes, they do matter because they lessen the percentages, like the chances of you getting it. And so it was such a struggle just to understand where the scientific community stands in it. There was someone who said masks, sure, but only N95, and really we need filters in every space. So it was it was very complicated to try to understand. It wasn't like one truth out there that was being communicated by community as a whole.
Yeah, these are great. And it also even ties back to yesterday with Dr. Prather talking about how we need to find ways to actually build filters into our interiors and really start changing them, whether it becomes furniture or just something that becomes integrated into it. And in some ways there's a way for it to naturally just kind of fall and be placed within an interior. And then the question is, how can a mask also become commonplace that just feels like it's also just naturally integrated into what we do every day? So so I like thinking about some of those things happening, one scale versus another scale, and with all the Swiss cheese model examples that we've seen, trying to take all those different layers to help figure out how to mitigate those risks, which, I can't help thinking also about, Amanda, with your work about working backwards from accepted risks. Like there's something, like I still have to wrap my head around that, just because it kind of opens up like everything. And I was wondering if you could talk a little bit more about that in an example. It just sounds like it's like so open, and then how do you start kind of figuring out the steps that one takes?
Yeah, that's a great example. A question. I guess an example would be, so we've done a few studies where we'll first look at what data are out there describing the magnitude of a pathogen in an environment. We'll do a normal QM and find a risk value, compare it to a risk threshold. And it's not until we see that value's over the risk threshold that we'll go, oh, that's not good. How many log reductions would we have to achieve to get below that risk threshold? And so the type of modeling that I do often implements Monte Carlo simulation. So we're generating many points from distributions of data and looking at, what about this concentration? What about this concentration, but my transfer efficiency is only 10%? What if it's 20%? And combining all of these views of variability and uncertainty to get a rough answer of what our log reductions might be. An interesting place where this sort of reverse QMRA is being done is in the world of direct potable reuse. So the treatment of wastewater and it being used to supplement our drinking water supplies. So a lot of places in the US are looking at that right now and working backwards, like what's in our wastewater? How well would we have to treat our wastewater to get to a 1 out of 10,000 risk threshold? What does that mean for the wastewater facilities? How much is that going to cost? What about residential applications? So like a certain, shower head I can use that maybe has some type of treatment element in it. So I think that the area of, we call it reverse QMRA in my world is going to be increasing. But one of the biggest questions that comes out of that process is, what is our risk goal? What are people willing to accept? And that's a really complicated question to answer.
Yes, that is such a great example, because water, we know, is one of those things that we really have to be figuring out how we're going to have access to it. It's very important. So that's so interesting to hear. So we've had a few more questions come in, and this next one, Yulia, came in for you, which said, "Thank you, Yulia, for such a fantastic representation of the design process and story. As a student in interior design, this is fulfilling to see, as I'm also experiencing learning the layers of design process. My question is, what are some techniques used in discerning and deciphering information that is useful versus an overcrowded message or an understated message?" That's a great question.
Well, I mean, I guess there's two sides of it. There's one is like trying to figure out what information is useful to communicate. And there's like, from the information that we're finding, so you're met with this barrage of sometimes conflicting opinions on what is important, what is, what is safe, what is out there. And it's a huge challenge. I mean, we start by seeking out reputable scientists who we can start having a conversation with, and way leads to way, and then somebody recommends someone else. Just strictly following journalistic practices, you're trying to get diversity of voices into it. So you're starting with scientists from specific institutions, but you're also looking at scientists or people working in the field from different backgrounds, because it's a very, there's a lot of gatekeeping in academia that is very hard to push through, and that does become very difficult for someone in my position to figure out what is the truth, and what are the motivations of the people who are speaking to us. So it's not just overcoming the amount of information out there, because you could do your due diligence, you could research for a few days, try to see whose names come up, whose names appear in scientific journals, whose names appear in the media. But then you start to wonder, well, why are the same names appearing in the media? Are they just easy to access? Are they able to get themselves out there? Whose voices are not being featured in scientific journals? So there's that issue, because how filtration works might not be as much of a debate. But when COVID was just starting, one of the first stories we worked on was about how COVID spreads. We wanted to visualize what happens when you cough or sneeze, and what happens to those droplets. And there were some scientists in the scientific community who were saying, it is airborne, it is airborne, it is not about the droplets. 6 feet are not going to save you necessarily, you need to do more. And then there's others who are like, there's no PPE, just don't worry about it. So it would, I even when you try your best, there's people there. There were 2 scientists I spoke to, and I will not bring up names, who had they weren't disagreeing with each other, but there was a bit of an academic competition of whose research should be featured, because it looked slightly different, and whose work we should use. And it was a lot of diplomatic untangling. But I think just sheer trying to identify what is, as the person Harleen asked, just trying to understand who has done a lot of research in this field, following them, but also trying to understand who are the other voices we should be hearing and have represented. And then how to bring, how to figure out what we want to say with it. And that's just, working with an editor and trying to hit those 3-5 most important points about the story. And that is the art of storytelling, of like working in the group and trying to really nail down and to bring it down to like a layman's terms, and filter out a lot of like things that are very important scientifically, but just may be very complicated for the public to wrap their minds around. And so trying to identify, I guess I'm just reiterating that it's very hard rather than answering, but it is a complicated thing to answer quickly.
Yeah, no, that's great. It does sound very complicated, especially trying to find those right voices to get information from. Yeah. That was a great question. So this one is maybe more of a comment, but I want to read it. So from our audience, this conversation is very interesting. It brings into the light the importance of integrating IAQ, indoor air quality, into building design. And I think that is where designers can have a big impact, especially in, I think, congregate settings like LTC and schools. So thank you for your presentations, because that will help us. It certainly does. And thank you for that question too, or that comment. And then there's another question that came through, and Amanda, it looks like it's for you. So thank you for mentioning some of the materials that can help prevent spread or decrease longevity of viruses. Can you briefly speak more to this topic? Is there others beyond copper? Is there a certain technical spec interior designers should be watching for to know we have a better material in relation to this topic, without doing the studies on each material type or searching for studies that have been done?
That's a really good question. I wish I knew if there was a specific spec. It's kind of outside of my my wheelhouse, unfortunately, but I just did a quick search so I could say something a little bit more intelligent about this topic. I know that there's, copper surfaces, copper impregnated surfaces, copper impregnated fabrics. There's also silver impregnated fabrics. So I know there's always kind of a cost consideration, but I've mostly seen the application of these materials within the context of healthcare. That's where a lot of the literature that I've seen lives regarding that. But honestly, I haven't stayed on top of that topic, so I can't say much more about it, other than I've seen increasing literature and increasing funding related to that topic.
Yeah, that was a great question. And I like these questions because it's, trying to bring things back to the interior, knowing that these are, there's so many moving parts, and it seems there's so many variables, and everything can change depending upon the variables. So in some ways for the interior, it's almost hard to get a grasp of what the right answer is. And part of that will also be explored tomorrow during the workshop that we have. And maybe that also leads me into another question that I had prepared, knowing that the two of you would be part of the same session. And so I'll just read the question for you. So after hearing the presentation of your fellow speaker, it'd be interesting to know if there's a point of connection or sharing in content that you see overlapping in your areas of expertise. If so, can you give any insight into the areas of these overlap? And the reason for asking this question is that when we have the workshop tomorrow, it's going to be bringing together different disciplines. And by learning how the two of you might see some overlap between your presentations today, it then helps the interior designers connect to these other areas of expertise that we'll be working with tomorrow, which do cover an overlap with your areas as well. So I'm just curious to know if there's points of connection that you see between your works.
Oh, I mean, everything for me, I was watering at the mouth when Amanda was talking. I would love to visualize like everything she said. It's, everything I do overlaps. Like if there's a specific topic that I need to address, I would, and if it involved pathogens, I would speak to someone like Amanda and try to understand, her work and learn from her words and whatever metaphor she can spare, like the spaghetti forest that I got while doing research for the masks. But there's such, I couldn't do anything without speaking to someone like Amanda to visualize the topic. I mean, I have the tools and I have the experience of telling stories visually, but I by no means have the expertise.
I was thinking as I was watching Julia's talk that the art of design and communication is just a creative process is very similar to science. I think sometimes from the outside, science might appear very linear, like this was, even in our papers, like here's the introduction to the problem. Then I did these methods. Then I set out and I did that. Then I analyzed the data. This was the conclusion, but I think there's a lot of like going back to the drawing board or like thinking, what exactly is the question I want to answer? Who's going to care about that question? How, what methodologies am I going to implement to best do that? How do I visualize my data in a way that means something to me and others? I think these are things that scientists struggle with on a daily basis, especially a junior scientist and assistant professor in my career. And so, yeah, I mean, one thing I was thinking about during my talk specifically and how it relates to Julia's is transfer efficiency, this exchange of microbes with surfaces and our hands is really hard to visualize and talk about. And there's even been inconsistencies about how we talk about it among scientists in that space, where we sort of assume or we're interested in like what goes from my hand to the surface or what goes from my surface to the hand. But the reality is there's an exchange. Things are traveling in both directions. So it's like, how do we imagine that? How do we measure that? So yeah, I don't know. I just was thinking about the parallels between the creative and the scientific processes a lot.
That was a really cool research topic, by the way.
Thank you.
Yeah, I feel like this could be the start of another story, or at least I would hope it could be. But this is really wonderful. I think we're just at the exact closing time for our session. And I mean, this is just incredible amount of material that has just come forward. And I'm so excited to be able to take this away and really happy about how it will help inform the workshop as well tomorrow. So thank you both so much for taking time to be here. I really appreciate it.
Thank you very much.
Thank you. So we have now reached the end of our two-day symposium. And I would like to thank for closing out our session, Dr. Wilson and Ms. Parshina Kotas for sharing their insight and helping answer questions, knowing that it'll help us for especially the interior design community. And as we begin to integrate this content with guidelines and understanding how it can better inform the way we design healthier spaces and interiors. And I would like to thank everyone for joining. I don't have many closing remarks, but I know there has been a few questions coming in, such as, will the recordings be available? Where can I find them? And it will take us most likely a couple of weeks to find the right platform to upload all the recordings, but they will be available, and please just keep an eye out on the website. If possible, I'll try and send an email out to everyone. I think whoever's joined and signed up, I have your email, so I can try to let you know as well where those will be made available, because I know they're incredibly rich with material that I hope can find its way into so many areas of everybody who's joined today and informing what you do in your work and your practice, or just general knowledge for yourself. So I hope to keep you updated in that. And if you have any questions, please reach out to me. I'm at the School of Interior Design at Toronto Metropolitan University, where I can be reached. And I'm hoping a lot of this will generate connections and collaborations across many different people. So with that, I want to just thank my team again. They have been amazing at make everything just go incredibly smooth. And for those of you joining the workshop tomorrow, I look forward to seeing you at the School of Interior Design. Once again, if there's questions, please reach out to me. And other than that, enjoy the rest of your day. And thank you very much for being here.